Okay, I'm going to start. People are still kind of coming on. You guys are here, so let's get going. Welcome again, Doug Blizzard with Catapult. I'm happy to be joined by Patrick Long, the CEO, founder, owner, subject matter expert, guru, whatever you want to call him, of Hero Health. And we're here today to share with you some exciting information about how you can use Hero Health, to really expand your benefit offerings, to make it a much better plan, to make it something that employees like and are proud of and are attracted by and retained by, but also one that helps us save costs. And so that's our goal today. You can obviously tell we're on Zoom. This is not a typical your hidden webinar. So if you have questions, please feel free to either just unmute yourself and ask it, or go down there in a little chat and chat it in. We really want this to be a discussion. We've done this so many times, we can kind of do it in our sleep. So we welcome your questions. If something doesn't make sense, or you want to ask or want to understand a concept further, that's where we are. So let's, you want to start the presentation, Patrick, and we will jump right in it.
Yeah, hopefully y'all can see that. Thank you, Doug, and joining us from afar today, always working.
Right.
Yeah, and you hit on it. We wanted to make the most use of your time here and talk to you about being a resource. That's why you're members of Catapult. That's why you enjoy the services and the value that they bring, and we're so happy to be a part of that of that equation for you in the benefit space. And what we wanted to talk about at a kind of a high or medium level today was a better way. A lot of frustration out there with the status quo, the traditional, however you want to frame it up. The options that you have had previously have been limiting and frustrating for many HR and financial professionals at mid-sized businesses. And so we're thrilled to be partnered with Catapult to become that resource for you. So we'll go rather quickly today, but the general sense of what we want to cover is a better way for benefits. And that has three components: better care, meaning steering to quality, instead of just, as somebody said yesterday to me, we give our employees an unlimited credit card and they just walk into places and ring up charges, and nobody tells them the price, and no one tells them about the quality. And so we start with quality of care, both on the physician or provider side and also the facility. And then we're going to talk a little bit about lower costs. How in the world can better doctors be lower costs? We'll talk a little bit about that, but saving money for both your employees. Everyone's focused on take-home pay increasing during these inflationary times, and also your plan. And lastly, more control. A lot of HR and CFOs and CEOs have been beaten down by the system to think that they don't deserve control. That you don't deserve your data. It's kind of crazy that United Healthcare, one of their biggest profit center for margin percentage is taking your data and reselling it. And all of them do that. They take your data, they don't share it all with you, they package it up and sell it to other people. And so you don't have control of your claims data, you don't have control of your pharmacy data. The PBMs are a big black box, and so crossing that bridge to receive what you deserve, which is more control. So better care, lower cost, more control is kind of the highlights of what we'll touch on today. And let me see if I can forward this. Okay, this survey came out this week. A lot of you know that Mercer, part of Marsh, is a large consulting firm, one of the biggest in the country, if not the biggest in benefits. And they surveyed 700, a little more than 700 employers of various sizes. And they asked them, what are you going to do in this current year, 2022, and next year? Do you have plans to enhance your benefits? Do you have plans to improve your benefits? And only 14% said they don't. So this was not about cost. This was about enhancing and improving the benefits offered to employees. And so 70% said they're planning to either greatly or significantly increase benefits for next year. That's 65 were doing normal things, and 5% said they're significantly. And 16% said they've already implemented a lot of improvements this year. So that was a big surprise to me, that these numbers usually are much, much lower. We're more focused on cost. And so to see that the focus is on enhancing benefits, improving things like health information, education, navigation, advanced EAPs, not your grandmother's EAP, but kind of more advanced in behavioral mental health, addiction services, and all the rest. A lot of things around enhancing benefits. So we wanted to share that with you today. The full report is out and available on PDF. We can put the link for you. And then Doug, I want to throw it back to you, because you wanted to talk a little bit about what we called Catapult's journey. And so do you want to share a little bit about where you were and where you are?
Yeah, happy to. So, I mean, Catapult as an employer, now we're talking about us as an employer now with roughly 55 or 60 employees on our health plan. We, like many of you, I've been here 24 years now. I came out of a large company. I was running a self-funded plan, so I was kind of used to that. And then I came here, and we, of course, were just going direct, fully insured, to a carrier. We became level funded at some point, but again, we were on that merry-go-round every 2 years or so. We were, getting that crazy increase, and we had no options. And so we would go, our broker would go shop out there, amongst all the various carriers, and we'd change every 4 or 5 years. I mean, we've literally had every carrier since I've been here. And that's the merry-go-round that Patrick talks a lot about, that really no control, no flexibility for us other than just, all right, we're going to threaten to leave and see what happens. Then at some point we started raising our deductible really, really, really high, and that helped us get better rates. And then we threw in an HRA to at least help the employees some. But again, just really no real options to so we had to make a decision. And we had also been looking, we being Catapult now as the employer association, we've been looking for about 2 or 3 years to find a better way for our members. We were getting constant complaints and suggestions, and can't you guys do something about this? I mean, you're so big. And we looked, Bruce Clark and I, our former president, we looked all over the country, and most models that we found were just kind of very confusing financial models where, and that would help you save a little bit, wouldn't do a thing about the care. So we just couldn't find anything until finally at some point, Bruce somehow met Patrick at an event, I think, and we started talking. And the more we got to understand Hero, and the more Hero was evolving, it's based on a national plan that was birthed out of a company called Health Rosetta. There's Patricks all over the country doing this same kind of thing. The more we learned about it and the more Hero matured, we said, hey, not only do we want to offer this to our members, we want to use it for our health plan. We're tired of being on the merry-go-round. So we got engaged with Hero, and our plan date is July to July. And so we started last July of 2021. So we've had a full year now, and we renewed. That's I guess that's good news number one. We renewed. And
that's always good news.
Yeah, but for us, I mean, what we found was it was interesting that this is a totally self-funded, This is not one of those hybrid deals. You're totally self-funded. Here we are with 55, 60 employees on the plan, and you say, "Gosh, you guys seem very small to go self-funded." And the way it works is really as we look after a year into it. I mean, our HR person's happy because employees are happy. Our CFO's happy. Basically, it operates kind of like level funding, in that we pay the same amount every month. We fund it to our max exposure for the year, and so CFO just writes one check a month and goes back to his job, and so it will never be more than that. And so that's been a good experience for us. It was not this vague, ambiguous, complicated deal. It was pretty much we took our old plan and mirrored the same plan. So it's the same plan. But the cool thing about Hero is on top of our PPO plan, which it gives us security and employees can go to any doctor. But on top of that is all the stuff Patrick's going to talk about today, which is all the Hero stuff, which basically boils down to just hundreds, if not thousands, of direct contracts that afford our employees anything from generic drugs to surgeries to lab work to radiology, urgent care, behavior health. They're all free. And so we talk about that first slide, enhancing benefits. We made a major step forward with Hero in that there's like 19 categories of free services. And I don't mean like, a 5% off, free. I mean, we have employees literally have to have a knee operation, and the MRI, the operation, the PT, it's all free. And you're like, yeah, sure it is. And Patrick will talk about how that works, but that's the truth. And so our employees have saved a lot of money. They've gotten better care. They love the nurse navigator. Oh my gosh. I mean, as you can see there, we've had 200 plus conversations. I think something like 92% of our employees have engaged with a nurse navigator. We saved 23%, which is about $200,000 in 1 year. So it's kind of like, again, I know it sounds too good to be true. Patrick will talk about how it works. There's a lot of mechanics here. But for us, at least, after a year on this, CFO's happy, HR's happy, most employees are happy. You can't make everyone happy. We all know that. But most employees are ecstatic with this plan. They saved a lot of money. We've had some significant savings for some employees on some pretty high-priced medications that came from, 10, 20,000 bucks a year down to zero. So, I mean, there's a lot. And you say, well, how can that work? Again, Patrick will talk about the power of direct contracting and how that works. But again, for us, it's been a great year. And that's why I'm always willing to run my mouth and talk about our first year, because I don't understand why more employers aren't on this. It's growing. We got quite a few members on it now. But it's definitely worth a look. If you're anywhere near the situation we were at, tired of it, frustrated, nobody's happy, employees aren't happy, you're not happy, executives aren't happy, costs are going up, costs are for everyone, services or benefits are going down. It's worth a look. It's worth a look, because we definitely, it's been very good for us. And I think if you talk to all the other clients on there, so most of them are members, or many of them members, they'll tell you very similar results in their first or second year. So again, that's our experience. So again, always happy to talk to someone. If you want to call me offline, email me, happy to talk to you about our experience and go as deep as you want to go. So with that, Patrick, it's all yours.
Yeah, thanks, Doug. There's nothing better than those types of personal journeys that your whole company went on. Obviously, it wasn't just you, but the whole company. And we do take the approach of continual improvement. So once we start to get data, it's a great thing, and we start communicating with a nurse and a pharmacist assigned to each plan. They start to develop relationships. It's not perfect day one. It takes months. Some people it takes many engagements. But now we're starting to get those relationships that are meaningful. And so people are less hesitant to reach out and ask the pharmacist about their medications, or should I be taking these two drugs together, or ask the nurse, who's the best pediatrician? I just moved to Cary or Charlotte or Greensboro or wherever. We're getting a lot of engagements, which is our kind of best metric for success, because once we're engaged, people don't go into the hospital and show that unlimited credit card and really get ripped off. We can steer them and navigate them to better care, and that's what the key is. I won't bore you with all the details on this slide, but you know that Catapult does a lot of polling, and other companies in the HR and CFO space do a lot of polling, and we took a look at all of the kind of what do leaders want questions, and no big surprise that the finance folks were focused on predictability was a word that came up a lot. They don't like volatility. They like predictability. And so like what Doug alluded to, you can choose smart funding, which is level funding, same amount every month, except you keep 100% of what's left at the end of the year. You don't split it with Cigna. Like level funded, you split it with your level funded carrier. With us, you keep 100% of the savings. And they're also not credits that you have to use against next year's premium. They're actual dollars, not even Bitcoins, as somebody told me yesterday. They're real dollars. So that's good. But they like predictability. Obviously, EBITDA is something we talk about a lot, and making the most of efficiencies with your cash flow. They want transparency. They want lots of data. And so, like we said, all of our data is transparent and shared and actionable. It's not hidden and packaged and sold. So that's important. On the people side, the focus from the Mercer study and everybody on this call is about, hey, that job market despite whatever record-setting inflation. The front page of the Journal today said highest inflation in 40 years today, 9 point something percent. And that it's still a real tough labor market. Usually those two things don't work in parallel; they work opposite of each other. But we're still in a tough war for talent out there, and retention is tough, and attraction's hard. Reputation matters, especially with younger workers. And so chief people officers all over the country are looking to, and the results are in that Mercer study. How do I improve benefits without breaking the bank? How can I enhance our package without getting the CEO and CFO upset about spend? And so you have to start looking at proactive plans. Having a nurse and a pharmacist engaging with your people is super important. Having increasing take-home pay with zero out-of-pocket options, huge for retention. And so we just wanted to highlight some of those today. And then Doug alluded to some of these things. When you compare the traditional or status quo PPO plans to what Hero does, the first thing that comes up is what Doug said, is like, it's too good to be true. How could you get lower costs and all that? And it is through the direct contracting and the engagement that enables us to spend half as much for a surgery as you would with your PPO, and that frees up a lot of money. But the next thing that people then say is, what about disruption? I bet if we switch from Cigna or United, or Aetna to Hero, there's going to be all sorts of disruption. And there isn't, and the reason for that is we put a PPO under the plan. And so if your employees choose not to go to the best doctor in Charlotte or Greensboro or Wilmington or wherever they are, they choose to go to the big hospital. Damn the quality reports, we just want to go to the hospital. If they do that, they just pay the same price they always have, because they get PPO has access everywhere. It's not a narrow network. It's not an HMO or an RBP scheme or anything like that. It's a PPO. And so they flash their card and they pay the full freight, and that's their option. So that takes care of a big checklist item for HR, especially, is access. And then other people ask about the surgery centers of excellence and how do you get all this data? It's available. Your PPOs, your networks, your carriers have all the same data we do. They just refuse to share it. It's a big revenue stream for them to sell that data. And so when your people get sick or they see a trigger diagnosis, like someone has high A1C, and that's going to lead to diabetes if something's not done about it, are they reaching out to that person and coaching them on how to change their lifestyle to get safe and healthy again? No. They wait until they get diabetes. Diabetics live 8 years less than people without diabetes, and have a real tough time of it. And it's super expensive to a plan, up to $250,000 for dialysis that we see. These are things that we think borderline criminal for the traditional system, that we refuse to play that game and get your claims up. We want to get people healthy again. And so our little bumper sticker is better outcomes and higher incomes for your people. With all that data, we do something about it, and we reach out appropriately with our nurse or pharmacist, doctors, and help those people live a better life, live a healthier life, spend less money personally and for the plan. And so that's a real important part about the comparison. And then steering them to centers of excellence. When we have all that quality data, that's who we go after. So we sign direct contracts with Ortho Carolina, sign direct contracts with Raleigh Ortho, sign direct contracts with the Surgery Center in Greensboro. We've got thousands of imaging centers around the country, 5,000 PTs, 800 surgery centers, all sorts of locations, all ranked and rated by quality. And that's where we're going to send you. If you still want to go to the hospital, you can go there. You just pay the same old rates you used to pay. And so that's how the plan works. Same thing on the pharmacy side. And Doug hinted at this too. these are just a few of what we call the power of zero. You know, this is really important for your benefits package. Second opinions are zero cost at the Mayo Clinic or Johns Hopkins. We have contracts with all the leading facilities in the world. If somebody gets a bad diagnosis around a cancer or chronic condition, you know, 30% of cancer diagnoses are wrong. Either the diagnosis is wrong or the treatment plan is wrong. They call it suboptimal in oncology. But man, wouldn't you don't you deserve to have a second opinion? So that's zero cost. Same thing with spinal surgeries. I saw a statistic the other day that 60% of spinal fusion surgeries are what? Corrections to previous spinal fusion surgeries. There's so many bad spinal fusion surgeries out there that it's super costly, and people have 2 or 3 corrections to them in their lifetimes. And so we get second opinions mandatory on spinal fusions, and you have to go to the top doctors for that. Lab work, we've seen $500 basic labs out of UNC that cost $80 right across the street. We have, there was a story on the news in Raleigh a couple of weeks ago of 2 working people, both teachers. One got a CT scan at a hospital on Blue Cross, and the other one got one at Raleigh Radiology on Blue Cross. $5,000 at one location, $600 at the other location. Same CT scan. And we got some comments from some Catapult members saying, hey, I'm glad we have a direct contract with Raleigh Radiology. I said, yeah, but you don't pay $600, you pay $300 without us. So not $5,000 or $600, you pay $300. And so we just go down the line and find all the high quality providers in America, but primarily in North Carolina, South Carolina, and Virginia, but all over the country now. And we sign direct contracts with them. And so they're far lower cost, anywhere from 30 to 70% lower cost than what you're currently paying.
Yeah, Patrick. So normally at this point, we either get the question or someone's thinking it. It just sounds too good to be true. And so don't want to go into all the details, but what I've actually been with Patrick on some of these meetings with these providers. And what you learn quickly is they all spend a ton of money. They have a ton of staff that you don't see when you go there behind the wall back there. That all they're doing is calling, you know, the government, Blue Cross, trying to get paid. It takes months in many cases. They're also calling employees and setting them up on payment plans because employees owe them $1,000, or if you got your MRI for $6,000, your deductible is $4,000. You owe So when they learn that Hero will number one, the employee owes nothing, so there's no chasing the employee for money. And number two, we're going to pay you electronically up to 10 days. You're going to get paid. The amount we agree to on a contract. It's just amazing how that price just deflates. It's just interesting. It's very interesting.
That's a good point, Doug. The folks that tell us is that the providers, it varies, but about 20% of the money at surgery centers is spent chasing after their money. So doing those payment plans, hiring people to call up your employees and say, hey, you forgot to make your $75 monthly payment for that MRI you had 2 years ago. Or you didn't pay for that knee surgery, you know, because you have a $4,000 deductible and you only had, you know, $800 in your checking account, so you're on a payment plan for a year. And they hire lots of people to make those phone calls, and then the other side of the building is calling Cigna and Blue Cross and Aetna, asking them for their money. And so they're like, you save us so much money by paying us directly, and you get us new business because these are really good, these are working people that need our help. We like that. And we pay more than Medicare, which they also like. Half of hospital revenue, about 45% is Medicare, Medicaid, and veterans. So we pay more than them, but we pay far less than Blue Cross, United, Cigna, and Aetna. And so we're in that sweet spot for providers. They really like the patients. They like that there's no payment, and they like that we pay out of your plans in 15 days. So that's a great deal. I know we're going kind of fast here, but we wanted to maybe take a step. This is a different direction, but we have these conversations a lot with smart business executives, and they get caught up, and I say losing the forest for the trees. And they'll talk about admin or the stop loss cost, the insurance, the risk cost. And so I show this pie chart to them, and we do it for every prospect we meet with, where we break out your claims. Now that's medical and RX claims combined. And then we break out admin or overhead, fixed costs, and then your insurance costs. And it often looks like this. I just de-identified a company here in North Carolina that we're working with. And they were so fixated on their admin costs being $10,000 more with Hero than they were with, I can't remember who the carrier was. And I said, wait, I'm focused on, when I look at this pie chart, what I want to reduce every day is the $810,000 you've allocated to pay claims. If we get that down 25%, that's $200,000. Why are you focused on the $10,000 that we're going to pay a nurse to help get the $200,000 savings? We've got to get the, whatever you want, the analogy, the cart and horse in the right order here. When I see something, when I break out your claims and where your money's going, we focus immediately on reducing claims, both in specialty drugs and on medical high-cost claimants. And it is a little more in admin. But over time, you pay less in insurance, less in medical claims, less in pharmacy claims. Those are all bigger slices of the pie than admin. And so it's important for y'all as smart executives to focus, keep your eyes on the prize. The big number here is claims. You need to be asking your broker and your carrier, what are you doing to reduce the largest slice of my spending pie? 75%, in this case, 76% is going to claims. What are you doing to reduce those? Stop talking about, Teladoc for $2 or whatever. Talk about overspending for, $100,000 surgeries that should be $30,000, that kind of stuff.
And this is the challenge we found, Patrick. If you're fully insured like we were, or even level funded, you really have absolutely no ability to affect that big Pac-Man looking pie over there. And so what we found ourselves, all you can do is try to affect that little small part, either from going from fully insured to level funded, or from changing carriers every 3 or 4 years. But you're really only affecting the small part. And like I said, Bruce and I, we saw so many plans around the country, all kind of different names, but all they were doing was impacting that 20% or so.
Right.
Really, okay, maybe you saved 1% or 2%. Okay, fine. But didn't do a thing to attack the claims side of it.
Yeah, and the underlying we won't get into it today, but just so you know, the reason why your carriers do not want claims to go down, they do not, is because under ACA, Obamacare, they signed a contract with the government, all of them did, that their profits were going to be 15% of your spend. It didn't take them long to figure out that 15% of $1 trillion is more than 15% of $1 billion. And so every time your claims go up $1, they get an extra 15 cents guaranteed. And so that's called medical loss ratio, MLR. And that's the underlying reason why under Obamacare, or since Obamacare, United Healthcare stock has outperformed Google and Facebook and all these other things. A heavily regulated insurance company is crushing Silicon Valley because they're guaranteed 15% of every dollar that premiums go up. So they are clearly not focused on reducing your claims costs. So how do we do it differently? And I won't read all this to you, but we'll send, I'm sure Julia can send this deck out to y'all. But it's really direct contracting. So if you look at the top example, Hero will only send you to the top doctors. So we have all the quality scores of all the doctors in the country based on volume, outcomes, complexity, accreditation, and loyalty to their facility. That's called the vocal score that we use. And then we have facility scores based on infectious diseases. Do you want to go to a 6% infection rate hospital or a 0% infection rate surgery center? I know which one I'd want to send my mother to, And so, but we sign direct contracts for things like knees, hips, shoulders, carpal tunnel, spines, everything, that are far less than what your PPO is paying. Why would the hospital do that? Well, Doug already alluded to the zero out of pocket, so they don't have to collect. They don't have to ask Cigna to be paid. We pay them directly. But also, guess what? Surgeons can own a part of a surgery center. They cannot own part of a hospital. So the top surgeons have left the hospitals where they get told what to do, and they've moved to surgery centers where they get to own part of the building. And so they're participating in the ownership of the surgery center, and they're getting paid directly. And so the top doctors have migrated out of hospitals and into surgery centers. We have all the quality scores. There's still some good doctors inside of hospitals, no doubt. But did you know on July 1st, thousands of doctors got their surgery kits and did their first operations in North Carolina? Guess who had more availability, the top knee doctor in North Carolina or the new guy that's looking for his first knee on July 1st? Well, Blue Cross, Cigna, and Aetna are sending you to the hospital, and they don't care about which doctor you go to. We will only send you to the top 2% surgeons. We've got all the data. We wouldn't let you go be the first knee from a new guy anywhere. You know, it's not going to happen with us. Or a new spine or new brain surgery or new hand surgery. But everyone on July 1st had a real good chance at getting a brand new doctor operating on them. So it's a scary day for PPOs. But you can see kind of what happens here. We send one bill. You don't get 8 EOBs that say this is not a bill, but it looks like a bill, and everyone gets confused and calls HR and says, what am I looking at? It's all bundled together. Similarly on the drugs, very aggressive on the prescription assistance programs that we do to get drugs like Humira, Stelara, Skyrizi, Enbrel down to zero. And we do it all with data-driven decision-making, predictive analytics. We get all your claims. They're organized by trigger diagnoses or high-cost claimants or chronic conditions. If you're a green, you can barely see that on there. If you're a green body, you just get a monthly touch, like July is Skin Cancer Awareness Month or Mental Health Awareness Month in May or something like that. If you're a yellow body, you need navigation. You're looking for an image, maybe an X-ray or an MRI or physical therapy, or you need to find a behavioral health specialist for your child, or whatever it is. We're navigating you to the best care. And then red bodies on every plan are chronic conditions, cancer survivors, diabetics, somebody getting surgery that week. And we have a care plan for everyone in red. So the nurses are reaching out to them and communicating with them and their doctor to make sure they're taking the right meds, they're doing the right things to prep for surgery or coming out of surgery, they're getting the right treatment, and we're communicating with them. And then we already talked about the second step, which is the provider platform. All the providers in America rated by what matters most. And then all of this is communicated to your members by a nice nurse or a friendly pharmacist. And that makes all the difference in the world, because all the data just sits there unless it's delivered appropriately. And if you're under 35, you probably text the nurse. If you're old like me, you might email. Some of us still use the phone occasionally. But the nurse is sending appropriate information to your members to ask if she can be helpful or he can be helpful. Same with the pharmacist. It's not bothersome, it's appropriate. And we have things like refrigerator magnets with the nurse's picture on it and a HIPAA secure line. Zooms. We build websites for our clients where you can put all your healthcare information, flyers, we have meetings in person or online. Any way we can engage with your folks that fits your culture is important. And so, kind of wrapping up, how do we do all this? We work with your broker. We work with brokers that will sign a transparency agreement. Most of them stay in the room. Some of them kind of skirt towards the exits when we say that. The broker has to agree to be paid transparently meaning they get one payment, either a PEPM or a consulting fee. They can't go in there and add $1.50 to every prescription, or they can't. We get rid of their tricks and say, hey, you've got to be honest with your clients, and we're going to hold you to it. We've got all the data, and we work with that broker to be better, give them tools. The best brokers are super excited about working with us. They see that this is different and this is better, and this helps them hold on to their clients longer. And so it's a good thing for the best brokers. And then we just go through a normal quote process where we gather up information like census and plan summary, renewal rates and stuff like that, and put that together for you. And and then, as Doug alluded to it, the process is very similar to like a level funded, where if you're paying currently $50,000 a month to a level funded program, and splitting the savings 50-50, we're probably going to be somewhere between $45,000 and $55,000 a month, fully max funded. And so you'll make those equal payments, and at the end of the year, you keep 100%. And so that's all that's all your money. And so that's, so the process is very much very similar, if not the same, to what you're doing today. Is how it works. We do monthly touch base calls, 20 minutes, standing meeting, we call them. If that fits, some groups ask us to do it every other month. One group asks us to do it quarterly. And so, but we offer that to your broker and to your HR team, just to have a standing meeting to say, here's what we're seeing in your plan, here's the performance year to date, and here's some things to watch out for. And can we do a health fair in September, or some sort of rewards program in October, or what are some things, smoking cessation, a behavioral health awareness, can we bring a doctor or a nurse to the next meeting? Whatever's beneficial to getting your cultural message out to people, we want to be a part of that and help facilitate that. And so communication and engagement go hand in hand, as you know, and we want to be helpful and proactive in that. And then, Doug, I just put a couple of FAQs here at the end. I think we've already talked about them, but maybe some people if anyone has a question, this would be a good time. If y'all have any questions or comments, we'd love to answer them. Sometimes people are shy, sometimes they're very talkative, but if y'all have any questions. Yes, Ava?
Hi, good morning.
Hey, good morning.
Goodness. I'm sorry, there's an emergency alert coming at the same time. Sorry.
We knew that would happen.
One of the slides mentioned an OOP benefit. Could you explain a little bit about what that is?
Where is that? Over here?
I think a little later, or maybe it's a little before.
Okay. Maybe on here?
No, before.
Okay.
Before. Right there.
Right here, the zero out of pocket, right.
Out of pocket. Oh, okay.
Yeah, so we call those OOPs, or zero out of pocket. So the member pays zero. For instance, in our plans, all the Harris Teeters and Kroger's, because Kroger bought Harris Teeter, it's zero out of pocket for 300 heavily prescribed generics. If you go to any Harris Teeter or any Kroger pharmacy, there's zero, and 620, I think, pharmacies in North Carolina, but about 13,000 nationally. So if you go to CVS right across the street here in Chapel Hill, or Walgreens right down the road, you just pay regular copays. But if you go to the local pharmacy, the Main Street pharmacy, or Harris Teeter, you pay zero. And we call that, zero OOP, or zero, power of zero, no money out of pocket.
I remember the first time I went to get my filled, and she kind of did a double take. She was like, "Wait a minute, something." Let me look at this again. And she's like, "How is this zero?" I said, "We're on Hero Health." She's like, "Hero, we need to get that for our, because we pay a lot of money. How do you get zero?" I'm like, "It's just zero. It's free."
We did. One of our partners made a mistake and sent out GoodRx cards as a bonus thing to a bunch of members. Like we have one of our clients is a Catapult member with 200 employees, and one of our partners mistakenly shipped out GoodRx cards. And so a bunch of there's a construction company. A lot of the construction workers went with their GoodRx card to the pharmacy and said, "Oh, look, I'm going to use this." And they were like, "Yeah, it's only $40." And they're like, "Oh, no, no, no." And they pulled their hero card. "Oh, it's zero." So they were, it was kind of it wasn't intentional, but it was a good lesson to everybody at how much better our program is than GoodRx or Mark Cuban's and all the others. It's a lot lower cost for both the people and the plan than a GoodRx or anything like that. But yeah, part of our ethos is Main Street over Wall Street. So we've partnered with all the independent pharmacies in the country, and they're on a network with about 12,000 pharmacies, and we have a really good contract with them. Hey, Naomi, I'm trying to unmute you. Can you hear me?
I'm unmuted. Can you hear me?
Yes.
Good morning.
Good morning.
A couple questions as I'm trying to continually wrap my head around this. I've listened to this presentation a few times. So it's a national service, or is it just in North Carolina?
No, that's a great question. We're focused on North Carolina-based companies. We also have some clients in South Carolina and Virginia. As you can imagine, the brokers around here have clients in those states. But we work nationally. We just have more direct contracts in North Carolina, South Carolina, and Virginia than we do in California or New York or Texas, So Catapult has members in several other states, and we handle them just like we handle the folks in Charlotte or Raleigh or Greensboro.
Okay.
But, like the Harris Teeter deal, or, it would be Kroger everywhere else, right?
Right.
And stuff like that. So we have more direct contracts here, but we have imaging, PT, surgery centers, spine centers, all over the country that are under contract with us. It's just the greater concentration of them are in North Carolina, South Carolina, and Virginia.
Okay. And my other question is sort of twofold. How many clients do you currently have on Hero Health? And then has there been a survey of the members or the belly buttons or the employees that are using the services, and is aggregate information about how they're liking the service available?
Yeah, so the answer to the first question is 10 clients as of starting August 1st. So we have 10 business or employer groups. We've been in business 18 months now, almost 2 years. It'll be 2 years this December. So we have 10 businesses right now. We have about 10 to 15 more that we're kind of in the queue that we're doing quotes for the future. And so we're still in that growth mode, or coming out of a startup mode into a growth mode. We have not done a survey of all client or all members. What we've done that kind of might answer your or address your question is we've added NPS scoring to our nurse and pharmacists.
Okay.
And so we'll start getting that data soon, which after you engage with your nurse or pharmacist, 72 hours later, you get a text to say, "Hey, Naomi, how did that engagement go?" 1 being, bad, and 10 or 5 being awesome. And you pick the stars, like Apple does the same thing when you buy something at an Apple store.
Right.
And then if you choose, say, 4 or 5 stars or whatever you choose, then it sends you another text saying, "Would you care to comment on the experience?"
Okay.
And about 60% of the folks leave a comment as well. And so we gather all that and we share it with our members, so that you'll see the real quotes from your real members,
Right.
in kind of in a report form.
Okay. And the minimum employee headcount is 25?
Yeah, by statute. Yeah, we can't work with, it's 25 on the plan.
Yeah.
And so, so if you have 40 employees or 30 employees and 25 on the plan, that would be the threshold.
Okay, thank you so much.
Thank you.
It's interesting, Pat, as I think about just the hundreds of companies we've exposed to this, and I've probably talked to 50 or more myself. It's just interesting. What this requires is it requires, as HR, as CFO, you just got to be willing to look at this a little bit differently. And a lot of us have just been used to that giant easy button called Blue Cross or Aetna or Cigna, even though that causes us and our employees all kinds of pain every day, and we all know that it is a giant easy button. And so we find that that's a lot of people, when they hear about this, they get excited about it. Then they take a second look, maybe with their broker involved, then they're like, and what's happened, I'd say probably in half the quotes we've done, Blue Cross or Cigna comes back and that 15% increase, well, you got a hero quote, okay, we'll do 2%, or we'll give you a 5% decrease. Now we have some members of those 10 got ticked off by that and said, okay, I'm done with this. But it really requires, I think, an HR and a CFO to kind of done with this. I'm done with status quo. If they're not there, so if you're not there, and I'm just kind of looking at this, odds are you won't go with this, because I wouldn't say it's more work. I mean, from an HR standpoint, it works the same. At CFO, it works. They're used to that. It's just the more work is. We have in every month, we have a once a month meeting with our employees just to remind them about how to use this. There's that kind of thing. So we got some members say, no, I'm not willing to do that. I don't have time for that. Well, if you're not, it really comes down to, are you willing to engage with this? And a lot of companies just aren't. We don't have time. We've been slammed with COVID or whatever. There's just not time there. And so I can tell you that there's 10, every member, again, Patrick says member, he's talking about goals, yeah, not members, but yeah, every company has renewed. Every company had a similar experience to us, and the size, we're the smallest one in the bunch. It goes up to about 400 employees. So that to me is powerful, that every company, there really isn't a risk here. There's not a risk here. You're not signing a 3 or 4 or 5 year contract. It's a year-to-year deal. So it's interesting, but there's a lot of facets. The main thing, I'll stop here. The main thing for our HR person that gave her comfort was the fact that it's built on top of PPO. So she knew this isn't some narrow network deal where it's risk. Now she knew that if I decide, if I'm one of these people, I was born in UNC, I went to UNC, I'm going out on my procedures at UNC, I'm going to die in UNC, then I can do that. And I just have a similar experience. But even with that, though, the nurse will help me find the best doctors with UNC.
Right.
That brand. So I think it's important. It's just a lot of people just they're not willing to engage it. The time it takes just to think about it, engage it, because it's not really a risk. It's not a risky move here. It's not. There's no risk here.
No, I think to your point, I think what everybody says, like you mentioned at the very beginning, there's 100 other heroes out there in various parts of the country, and we all share our information. So we learn what are the best contracts for Mayo Clinic, and what are the best lab work contracts with LabCorp and Quest and Mako Labs, and what about urgent care and all that, those kinds of things. We share all that data and advice. And what we also share is the experience that you just mentioned. Why aren't more people doing it? And while we're very appreciative for all the people who have, I think it comes down to this mindset shift that you have to be, this is where it's going, and everyone will tell us, I'm definitely switching, but not this year, because Blue Cross found out we were getting a quote from you and they reduced us 10%. We got that the other day, stuff like that. And we're like, but you complained about retention and recruiting and out-of-pocket expenses. All that was going to stay the same. They're like, yeah, but we'll be back next year. And so we know we're switching. It's just not right now. So we get that a lot, and we're going to be here for them. But yeah, I totally understand. I think it's about having that. Are you a reactionary executive? Do you see something happen and you react, you put out the fire? Or are you strategic and you say, I'm going to position our company to be in the best place for 3 years from now, 2 years from now. I've got a vision of where we should be in HR and here's what we need to do. And benefits are a huge part of that. If you're reactionary, you're probably not going to join us right away until you get that 40% increase, and then you're going to come begging. and we might not be able to help you. But if you're a strategic planner, we're those are the folks that join us, are the people who are more strategic in their thinking. Stanisha, I've been talking so much, but you raised your hand. Are you there? Do you have a question for us?
Yes, I do. Thank you. And I joined a little late, so I may have missed this, but for people who love their health savings account like myself, how do those work, or do they work with this?
Yeah, that's a great question. And it's typically the HSA is the biggest problem for offering these. You have to drain your $1,000 typically, or you have to use your HSA dollars first to stay in compliance with the HSA rules. As somebody said, it's like driving whatever 60 and a 55. You're not going to get pulled over. No one's ever been fined for it, but no one wants to be first. So we have a lot of plans that have removed their HSA to do more zero out-of-pocket options because it's more efficient. They maybe put it in an HRA, or somehow use that money to get that money to the employees in a different avenue. We have people that have kept their HSA and said we want to work around it, which is causes some headaches. And then we've had people that never had an HSA, obviously, and so they don't know what they're missing. So it kind of falls into all three camps. But if you have an HSA, you like the HSA, then offering the zero out of pocket can be a headache for our team, because you have to tell the employees that have the HSA that they have to spend that money first. HRAs are not a problem, but HSAs are. It's just the way the rules were written.
So to be clear, they have to spend the HSA money before they can be on a plan.
Before they can get a benefit waived.
Got it. Okay.
Yeah. So in other words, if you have a $4,000 deductible and you want to get a surgery, you want a knee surgery at Ortho Carolina or wherever, that's going to save you money, you have to spend the $1,000 first, and then you get the rest of your deductible waived after the HSA's been utilized. And so the person without the HSA would save the whole $4,000. The person with the HSA would save $3,000. They'd have to spend that money first.
Okay, thank you.
That's
It is safe to say, though, if you look at it in the totality of this, you really wouldn't need an HSA with this plan, because that HSA is designed to save money to pay your deductible. In many cases, you're not going to have any money to have to pay for on this plan, right?
That's exactly right. And that's what some people have come to the conclusion a year in was, why did we keep the HSA? It just caused a lot of headaches. And, these are just a few of the zero out-of-pocket options. We would much rather have, one message out to our employees: call your nurse first and you'll pay zero if you go to the high quality provider for any of these things and many more. And the HSA is just an asterisk that gets in the way because, it does. Now, if they accumulated, $5,000 to $10,000 worth of HSA, they keep that money. I mean, that's their money. Nothing happens to your HSA if it goes dormant. It's still your money, and you don't have to. If you have $5,000 or $10,000 in your HSA, and a new plan year starts, you do not have to spend old HSA money before you get the zero out-of-pocket option. That came up a couple of times. That's a great question, Stanisha. Thank you.
And of course, you can use HSA also for the thing like emergency services, things like that. Obviously, Hero does not cover. They're not a contract for everything, and we're not nowhere near do we suggest, I got in a car wreck, I'm gonna call my nurse first. No, you got in a car wreck or you're having a heart attack, you're going to the hospital. We
significantly reduce unnecessary ER visits, but the key word in that sentence is unnecessary. That's important. Hey, Eva, can you?
Okay, sorry, one final question.
Sure.
How do we schedule some time to speak with a Hero representative to discuss like cost benefits or compare it to our current plan?
Yeah, so we would work either with your broker if you want to keep your broker, and we like to train brokers. Then we would engage with your consultant, your broker, and they often like to manage that process with us. And we would send you a secure link, and you would send us your census and your plan summary PDF and any claims if you have them. Again, a lot of companies, especially those under 100, don't get any claims. And so we would put together a side-by-side comparison of those three things: quality of care, cost of care, and control. And those are the three things that matter most. And we would share that with you.
Thank you.
We went live. We literally had our broker went out, and they got us a quote from Cigna and from Blue Cross, and then we had the quote from Hero. And they would look, and we had a spreadsheet with 3 columns, and we just looked at them, and we looked at the bottom line cost, and it just felt very normal. It felt very usual, very typical that we were used to. We just added Hero as a column, and we could then make it.
Yeah, I think I alluded to it when we talked about the pie chart. It's the, this, where was that? This right here. This is the problem where this is the page that I keep up for a long time when I talk to CFOs and after HR understands, hey, this is going to improve our retention, increase our attraction, and help with our reputation, and all those other good things. And then inevitably the CFO will look down and see the admin, went up $10,000, and he's like, wait a minute, what is that all about? That's why we keep this chart up. And if you put in Hero, you're going to spend on average 27% less for drugs, sometimes 40% if you have specialty meds like Enbrel and Humira. And you're going to spend 20 to 25% less on medical, sometimes 30 or 40 if you have high cost chemos and lots of ortho surgeries or something like that, where we really save a lot more. And so reducing claims by 25% on average is what we do. And that is worth a little more admin to get a lot more claims reduction. And if you get the claims down, guess what? Your insurance costs go down too. But your admin never goes down. It stays the same because we have to pay our nurse, we have to pay our pharmacist. And so we have to enlist professionals that aren't free to fight to reduce the big slice of pie. And so that's the challenge. Like Doug said, you have to have a new way of thinking. And so I think this lays it out there. This is where your money's going. Which one do you want to focus on? And I would vote for claims. But I know we're up against the hour, and I appreciate all the time that y'all gave us and your valuable time. And if you have any questions, I know Julia is going to be reaching out with the deck, and she's always available to set something up if you want to have a Zoom or trade an email or anything like that. We want to be a resource for you. So thanks so much for hosting Catapult, and thanks everybody for attending today.
Great. Thank you, everyone. Again, look for an email from Julia. And again, happy to talk to you. And Patrick's happy to engage with you and your broker. I mean, really, if you're one of those 70% looking for a way to enhance benefits, there's really no reason why you shouldn't at least give this a look. It's painless. No one bites. And you can make a decision, intelligently, looking at all more options than just switching from Cigna to United to whoever else. So with that, we're going to sign off. Have a great rest of your day, and hopefully look forward to talking to you in the future. Take care.
Thanks, everybody.